Just recently, there was a strange disease. They're calling it strange because we are not in the medical profession. We may be lacking. In Kisii. And it was linked to contaminated water. So how are we, prepared to deal with such outbreaks? And first, maybe you can tell us, we are calling it strange disease. What was it?
Well, let's just call it the strange disease in Kisii.
All right.
But we were able to unravel what exactly was happening. And it was one area, one water point, where the water was contaminated with fecal matter. And because once we took the samples in the lab from the water in the houses and the water from the pipe, the results were the same. And therefore, we were able to have the prescriptions done better for the people who had been affected. About 8 villages had been affected. What we did was to close that place so that the people from that area could get water from another point. And and we also sent our community health promoters together with the national administration to ensure they go from door to door and ask the people to boil their water. And if you're not boiling, then make sure the water is treated that you're taking. Because some of these things, basically, it's out of how we deal with them from a layman's perspective. And that is why when you asked me what is our work, I also said health promotion is part of it. And this we are doing very well with our community health promoters. In terms of screening, ensuring that we are encouraging people to also go for screening for diseases like cancer, so that it can be detected early. Our community health promoters, if I may go on to talk about them, is a great force. We have 107,831. As at today, 29 million people have already been screened for diabetes. And out of that, 340,000 have been referred to a health facility for further assessment. 19 million people have been assessed for blood pressure. And out of that, 744 have been referred to a health facility for further assessment. What does this mean? That most of us are working patients.
Indeed,
we may not know. We may not know.